smells like rotten eggs.
I wouldn't, if you're just giving me some nasty crap to take.
Yeah, the KX-Lite's going to make you poop like a goose, but it might save your life. Hiya, everybody. Welcome back to Nursing with Benomi. It's Benjamin, a.k.a. Ben the RN.
Hey, it's Nurse Nay.
So, hey, guess what, everybody? We're going to be talking to you today about communicating with patients and about, what's the word we were trying to go for? Trying to
encourage patients to follow their doctor's orders.
Encourage them.
Best for them.
Yes.
And in some cases, that includes compromising. Okay, so I have an example of a patient with sleep apnea, and she has to wear a BiPAP whenever she's sleeping or taking naps or whatever, but she totally refuses. So her CO2 gets critically high, then she starts to lose consciousness, and the first time I experienced this patient, she went unconscious, and I had to send her out to the hospital. This was in the long-term care facility. Had to send her out to the hospital. The only thing they did there was strap a BiPAP on her and send her back, and we had to do the BiPAP, at the facility. Well, she refuses it, so I just had to start telling her and educating her, like, if you don't use this, and she's a full code too, she won't become a DNR. So I just have to tell her, if you keep refusing to do this, you're going to go unconscious, we're going to have to send you to the hospital, and they're just going to put it on you at the hospital, and then they're going to send you back here. So either way, you're going to end up with it on. So that usually, she will go ahead and do it, and we just have to kind of bargain with her, and it's like, at least just wear it for like an hour, just like wear it for some period of time, and she does it. So it's not like 100% compliance, but it's better than nothing. So that works. And then, like the other day, I have a patient who had this dressing on his foot, and he had a little boot that helps, a pressure relieving boot to wear. But he kept, first of all, kicking the boot off, and then he was trying to tear the dressing off his foot too. And he just wanted everything off his foot. Well, that was not going to happen, so I had to compromise with him. I said, how about you leave that dressing on, and we'll take the boot off for a little while. And he was like, okay. So, it's some give and take. It's not going to end up with 100% compliance, but a little bit is better than none. So. And sometimes, too, patients may not like a pill form, but they'll be open to accepting like a liquid form of the same medication. So you can keep that in mind, too, kind of, change up the formulation of the meds. So.
Yeah, and make sure you have a doctor's order before you do that.
Mm-hmm.
Because, if they're going from, say, those big giant KCL tablets to the liquid form, yeah, that requires a doctor's order. So don't practice medicine without a license.
Yes.
So, yeah, and when it comes to compliance, see what these names make you think of. Mucomist, KX-Lite, Lactulose, heparin, Q4-hour IV penicillin. Not all of them are terrible, and they definitely have their place in the acute care environment. But, man, patients hate that. And Mucomist
smells like rotten eggs.
Yeah, no, really smells like rotten eggs. It's terrible. The first time I gave Mucomist, I was a brand new nurse, and I forgot to cut it with juice. So I'll never forget that in my life. Yeah, KX-Lite. People need that. Otherwise, they might have a cardiac arrest, which I've seen from potassium that's too high. Anyway, these are medicines that people don't like. And not to even mention Go Lightly. So, bowel prep.
And I think a big thing, too, is education. If they don't understand why they're going to be taking this disgusting medicine, then they're not going to. Like, I wouldn't. If you're just giving me some nasty crap to take just for the fun of it, you have to educate them as to why.
And kind of the sad part about most of that stuff is that the compromise approach won't work. Like, you really can't bargain somebody into taking only half of their, go lightly, because they're going to get an incomplete prep. So sometimes letting patients know about the consequences of an incomplete prep, the consequences of not taking this medication. Yeah, the K-Xylate's going to make you poop like a goose, but it might save your life. Okay? The heparin, yeah, or wearing the SCDs, doing the heparin shots. Yeah, it's annoying. It's going to make you, look a little purple and stuff. But guess what? It might prevent you from, throwing a clot. So it's kind of important. And then again, there are some folks that are completely in their right minds that have the ability to determine what course of treatment they will or will not take. Just pick your battles, because, if you're a new nurse, you may come in all gung-ho and feeling really pumped up and like, oh no, they can't say no to that. Yeah, they can. People can say no to whatever they want to, even if it doesn't make much sense. People absolutely have the right, and I would even embrace that and encourage that, for people to ask questions. Hold the physicians accountable if they do not feel that they explain something well enough. Like, why do I need to do this or that? I don't want to do this or that. Document it. Call the doc and say, hey, Mr. or Mrs. So-and-so, they have some questions about this procedure. Let them know. They're allowed to refuse procedures unless they're determined to be incompetent to make their own decisions.
Yeah. And even then, confused patients, they still have the right to refuse. That's not to say that when a confused person says, no, I don't want that, you say, okay, and throw it in the trash, the pills or whatever. But you want to attempt a few times, but ultimately you can't force things on anybody. So
yeah, because that's considered assault. So be good nurses, be good nursing students. So kind of to recap, remind folks of the consequences, educate, ultimately respect their autonomy, respect their decision-making ability to determine what they want to do with their healthcare. Peace out, guys. Thanks for watching.